tooth must be reduced in amount commensurate with the bulk that is to be returned via the restoration. And this is why we do need some axial wall reduction at the gingival margin. But where most preps fall down when it comes to traditional crown and bridge is the occlusal reduction. Occlusal reduction of our preparations need to have 3 planes, and these are indicated by the red dots. Our restorations must contain a bulk of material that is adequate to withstand the forces of occlusion, or you'll see the problem that I just reviewed on that single crown. And of course, this bulk is confined to the space created by the tooth preparation. And only in this way will be able to create occlusion that is harmonious, and the axial contours will be ideal. In fact, this is a topic Mike Melkers and I will be covering in the near future. How about margins? Well, margins are interesting. The margins that you were taught really depended on when you went to dental school. So if you're an older dentist like I am, you were taught the bevel. And why is that? Again, multiple interactions. And I think Rosner kind of addressed this the best. And he noted that all castings have inherent errors of significant character. And the preparation of our teeth should be modified to try to cancel these errors as much as possible, and to make use of the certain specific properties of gold castings. What did he mean by that? Well, there are a number of dimensional changes that occur with everything we do to fabricate a cast gold restoration, from taking the impression to actually casting it. The wax distorts. The investment distorts. Burning out things, casting gold metal and having the metal cool. All of these dimensional changes occur, but ultimately we know at the end of the day we get one total change, and that's a slightly oversized restoration. So the restoration's a little bit bigger than the preparation itself. Now, we also were taught the bevel because of what was described as the mu angle. And the mu angle stated that as the horizontal component of our restorations were seated on the tooth, that a bevel would seat faster than the horizontal components, like the occlusal surface or the shoulder of our preparations. The problem with the mu angle is it did not take into consideration the presence of a luting agent, and that is critical to understand. But let's go back to the materials and the science of cast gold restorations and impressions. So here's an example. It's an old example of a proximal partial veneer crown I did on a cuspid, and you can see their Kodak slides. And again, with a bevel and a slightly oversized restoration and a material that is malleable and burnishable like gold, we can get a fit and finish like you see on the right. This is after the cement's been cleaned up, and you can see that that margin looks like it's been painted on the tooth. And this was the beauty of the material and understanding the concepts of how to use it. And this was why the bevel was so popular. As time has gone on, we've found that, really, that margin design could be different, and we could still get great fit and finish. In fact, a horizontal margin will fit every bit as well as the appropriate bevel. And the reason is again, I alluded to it a little earlier, is that the mu angle did not consider cement in place. So when cement is present, it turns out a 90-degree horizontal margin seats every bit as well as a 45-degree or 30-degree bevel. So consider our margin designs and how we can get things to fit best. Because one of the things we talked about in the triad of mechanical is trying to preserve as much tooth structure as possible. So when we look at traditional preparation designs that may have been taught, like the classic shoulder, it has maximum tooth destruction and maximum stress on the preparation. And these preparations do break. What we really want to strive for ultimately are preparations that create minimal stress concentration on the tooth. And this is where the knife edge or the verteprep shines. It creates the least amount of stress of the tooth itself. The other two preparation design concepts that have minimal stress concentration are the chamfer and the deeper chamfer, although the deeper chamfer is going to take away more tooth. Okay? It is critical to understand that there are no significant differences in the axial and marginal fit of preparations with shoulders, shoulder bevels, and chamfer finish lines. And when using metal ceramic, there's no significant difference in metal distortion at the margin utilizing a shoulder bevel, or chamfer. So from that, we should take away these destructive preparations that utilize shoulders and only focus on the chamfer. In fact, I think I can safely say if I only had one diamond, it would be a chamfer. And this happens to be a picture of my favorite diamond. It is 1.4 millimeters in diameter, and it's an excellent diamond to use. And why is that? Well, with the chamfer diamond, we can get different amounts of reduction, and we can get different finish line exits depending on how we utilize a diamond. So in the posterior, where we don't need as much reduction, if we only prep partially to the radius, we can get enough reduction for restorative material, and we can get a nice 30 to 45 degree margin exit angle for good seal. Now, if we need more reduction, say for an aesthetic zone situation, if in a 1.4 millimeter diameter chamfer diamond, we can prep to the radius and get enough reduction for aesthetics and still get a nice horizontal exit line. And the beauty is with the chamfer is we don't have this destructive, stressful reduction or this shoulder that a shoulder bevel would have given us, or a straight shoulder. You know, Johnson did a very interesting study evaluating the marginal gap of milled versus cast gold restorations, specifically focusing on chamfers. And what he discovered is that for chamfer preparations, milled copings had a significantly smaller vertical marginal gap than our cast copings before adjustments. And again, this is because of extractive methodology, that the internal of the crown is a little bit looser so the margins fit better. Cast restorations fit better, but they need to be adjusted. And what Johnson found is that the cast copings were much more accurate following these internal adjustments. So the chamfer is a good restoration margin design. In fact, this is what Dr. Schillenberg advocates in his textbook of the Fundamentals of Fixed Prosthodontics. And these are images from his textbook that I've modified. And so when you talk about a posterior tooth, you can do a light chamfer and have enough room for restorative material. And when we're in the aesthetic zone, for an anterior aesthetic case, you can use a heavier chamfer and again, have a nice exit angle. I want to spend a little tangent here and talk about the aesthetics of all ceramic crowns. Okay, we assume and we say that they have better light transmission, and that's because there's no metal to deal with. All ceramic crowns have better color when the tooth cannot be reduced sufficiently. Understand, this color advantage decreases when the tooth is intensely pigmented and the tooth reduction is more than 1 millimeter. And this is, where we get into trouble because we think, oh, it's a dark tooth, I'm just going to reduce more and give my lab more room. Well, that doesn't work because you end up diffusing more light, and this makes the value drop in these restorations. So all ceramic crowns produce their best color match when the tooth reduction is between 0.8 and 1 millimeter. But in the hands of a good technician, this is more than enough room for metal ceramic. And so let me share with you a couple of examples. Here we have a couple metal ceramic restorations with chamfers and a disappearing margin. And a disappearing margin is difficult because you have three materials ending at the same point. You have metal, opaque, and ceramics. But you can see the marginal fit, the contour, and the aesthetics is quite good. And if your technician, really likes to do some fun things, they can do a porcelain lift-off using metal ceramic and a chamfer. And here's an example of that. And it's this first molar, and you can actually see the margin is equigingival. Actually, it's slightly above the gingival, and you can see how nicely sealed you can get using this technique as well. And when it comes to metal ceramics in the anterior aesthetic zone, again, we can get good color matches, good results, and we do not need heavy shoulders.